Dear friends, you will agree with me that whenever we face failure in life or some mishap happens in our family, we feel depressed, but we become normal over a period of time. Today, we will learn about depression. So, let us start with some interesting fact about depression. Depression is known as the common cold in psychiatry because around 340 million people in the world suffer from depression. As per the global burden of disease, by the year 2020, depression will be the second most important disability in the world. Not only this, 1 in 4 women and 1 in 10 men can expect to develop depression in his lifetime. 50% of cases of depression are unrecognized and untreated. So, there is a dire need to create awareness among the population about depression and to bring them into mainstream of treatment. Last but not least, as high as 70% of depressive patients have suicidal tendency, and you will be surprised to know that out of these around 10 to 15% actually commit suicide. So, my dear friend, it is very important to diagnose and treat depression. Let us learn more about depression. According to WHO, depression is a mental condition characterized by depressed mood along with loss of interest, guilt feeling, disturbed sleep or appetite, low energy and poor concentration. The symptoms of depression can be memorized by an acronym called SIGECAPS-D, where S stands for sleep disturbance, I stands for interest loss, G stands for guilty feeling, E stands for energy loss, C stands for concentration loss, A stands for appetite change, P stands for psychomotor retardation, S stands for suicidal tendency, and last but not least, D stands for depressed mood. So, if you remember these symptoms or SIGECAPS, you will be able to recollect all the symptoms. So, let us learn the classification of depression. Depression is classified in 2 parameters, according to severity and according to cause. According to severity, there are 2 types, mild depression and major depressive disorder. In mild depression, less than 4 or 5 symptoms are there for more than 2 weeks. In major depressive disorder, more than 5 symptoms along with depressive mood are there for more than 2 weeks, and that too with somatic symptoms like headache, backache and pain. On the other hand, depression is classified as per cause in 2 types, primary depression and secondary depression. Primary depression is also called endogenous depression, where the patient is actually suffering from depression. He is not suffering from any other disease. Depression is the main problem, then it is called primary depression. On the other hand, if patient is suffering from other disease like cancer or diabetes or hypertension, and because of this disease patient develops depression, that is called secondary depression or exogenous depression, and sometimes it is called reactive depression. So, for the major depressive disorder is concerned, which is also called as MDD, it is a condition when 5 or more depressive symptoms including depressed mood along with somatic symptoms like headache, backache, limb pain, joint pain and GI disturbance like irritable bowel syndromes are present for at least 2 weeks. Then we will call it MDD or major depressive disorder. So, let us recap the common cold in psychiatry. Depression is known as the common cold in psychiatry because around 340 million people in the world today suffer from depression. According According to WHO, depression is a common mental disorder characterized by depressed mood along with loss of interest, guilt feeling, disturbed sleep, appetite loss, energy loss and poor concentration. Then we saw symptoms of depression which can be memorized by acronym SIGECAPS-D. S stands for sleeplessness, I stands for interest loss, G stands for guilt feeling, E stands for energy loss, C stands for concentration loss, A stands for appetite change, P stands for psychomotor retardation and S stands for suicidal tendency. Then we saw the classification of depression based on severity. There are two types: mild depression when less than 5 symptoms are there, major depressive disorder MDD when more than 5 symptoms of depression along with some somatic symptoms like headache, pain and stomachache are there. And based on cause, primary or endogenous depression where depression is the main problem, and secondary or exogenous depression when patient is suffering from other disease and due to the disease patient develops depression. Last we saw MDD or major depressive disorder, a condition where 5 or more symptoms persist along with somatic symptoms like headache, backache, limb pain, joint pain and GI distress.